So in this video we are going to discuss about the lower back pain, the definition of lower back pain, McKenzie concept, the prevalence of lower back pain, etiology, and some of the solutions that a physical therapist should know. Now, starting with the definition, what is lower back pain? Lower back pain can be classified from pain anywhere between from the last rib to the lower gluteal fold with or without the radiating pain in the lower limbs. Now, it is a most common healthcare related problem in a primary care practice. Now, stages of severity. Classified as 3 stages of severity. First is acute phase. Acute phase of lower back pain starts from sudden onset and lasts less than 6 weeks. Second is subacute lower back pain. Now, subacute lower back pain that lasts anywhere between 6 to 12 weeks. And the third and the most severe stage of severity is chronic lower back pain. Now, chronic lower back pain lasts anywhere between 12 weeks or more than 12 weeks. Why we are discussing lower back pain today? Because it is estimated that approximately 70 to 85% of general population will experience lower back pain once in their lifetime, or maybe even more. Now we'll come back to the McKenzie concept. Now let me tell you a brief overview about McKenzie. So Robin Anthony McKenzie, I always pronounce the full name to give them a respect, presented a back exercise protocol in the year 1950s. It was also known as MDT, that is Mechanical Diagnosis and Therapy. McKenzie exercises have become so famous that later days it was also known as a spinal extension exercises. Now, let me tell you what is extension exercises. Extension exercises you can resemble Bhujangasana in a yoga or a cobra pose. One more movement specialist, Dr. Williams, gave a different set of exercises that became lumbar flexion exercises, simply to say sit-ups exercises. But why we are discussing McKenzie protocol today? Because research suggests that flexion increases intradiscal pressure in thoracolumbar spine. Now, thoracolumbar spine is spine anywhere between lower of your neck towards the waistline. Now, McKenzie concept has 2 key concepts that McKenzie focuses on. Number 1 is postural correction, correct your posture. And second is repeated exercises at the end range of motion. McKenzie gave a big concept and he divided it in 3 syndromes. The first we'll discuss as a postural syndrome. The first and foremost is postural syndrome. Now, postural syndrome says a mechanical deformation of soft tissues and even the vasculature resulting from a sustained postural stress that comes on the joint surfaces, muscles and tendons, and can occur in prolonged standing, sitting and even laying down. So maintain sustained posture is the reason behind the lower back pain for a prolonged period of time. A faulty posture for a prolonged period of time results in a lower back pain. So what is the solution? Through correction of abnormal posture releases the deformation on the joint surface, muscles and tendons, and results in immediate relief in the lower back pain. So that's the first syndrome. It's a postural syndrome. Now we'll come to the second syndrome, that is a dysfunction syndrome. Dysfunction, something is not functioning properly. Defined as a mechanical deformation from structurally impaired soft tissues. It can result from either traumatic, inflammatory or degenerative processes. Now, these 3 processes, traumatic, degeneration and inflammatory processes, will result in either a tissue contraction, scarring and adaptive shortening. Tissue contraction is like shortening of the soft tissue. If a person has a trauma, they don't want to move. So tissue contraction. Second, traumatic event will lead to inflammation inside the muscle. So muscle scarring. And third is a adaptive shortening due to degeneration. Degenerative processes changes the posture, changes the muscle length, and patient is in a stoop posture. So it will go in a adaptive shortening of some muscles and lengthening in other group of muscles. The hallmark sign for dysfunction syndrome is loss of movement and pain at end range of motion. I'll try to explain. Loss of movement. So you see an older person walking in a stoop posture. So loss of movement, loss of extension first, and pain at the end range of motion. If you ask a person to straight or go in extension, they don't want to. So pain at the end range of motion. Pain is stopping, so they don't want to. Dysfunction has 6 sub-syndromes: flexion, extension, side glides, multidirection, adherent nerve root, and nerve entrapment. Now, what is the successful treatment strategies for dysfunction syndrome? First is a patient education. So educate the patient. Why? Because you have a trauma, you have a inflammatory process, and that the tissue will contract, go into contraction, protective contraction, and you don't move, so will lead to pain. So first is a patient education. So go with the modalities: cold pack, hot pack, to release the pain. And second is mobilization exercises towards the direction of dysfunction. You have to mobilize the patient towards the direction of dysfunction. So whichever side patient don't want to move, they have to move slowly and gradually within their pain limits. Now, third syndrome, according to the McKenzie, is the derangement syndrome. Dearrangement. According to McKenzie evaluation, 78% of the patients fall into derangement syndrome categories, according to the McKenzie movement analysis. Now, let me try to explain. Derangement syndrome, it is the internal dislocation of the articular tissue. Let's say an intervertebral disc, to be specific. So internal dislocation of the one vertebrae and the second vertebrae. So internal dislocation of the articular tissue, disc bulge in a posterolateral direction. That is causing disturbance in the normal position of the joint surface, surrounding joint capsules, and periarticular supportive ligaments. This will generate, first of all, pain. Second, obstruction movement. Obstruction of the movement in the direction of displacement. Disc bulge in a posterolateral, patient don't want to go in extension. Now, in this subsyndrome, pain can be generated from provocative movement assessment. You check extension, patient will say pain. Now, centralization and peripheralization can only be seen in derangement syndrome in the McKenzie movement evaluation. Now, let me explain what is centralization and what is peripheralization. Peripheralization is a worst prognostic sign where a lower back pain radiates down to either of your lower extremities or sometimes both. Centralization is a good prognostic sign where a lower back pain will start to disappear or fade away from the lower limb and going towards the problem of derangement that is in the lower back pain or in the lower back area. So centralization is a good prognostic sign. Treatment focuses for derangement syndrome is a repeated movements in a single direction that causes gradual reduction in nociception or pain. Thank you.